Hello, welcome to Shooting the Shit. Here we are again. We are talking today about women and healthcare and the workplace because on Wednesday this week, the 7th of April, it will be World Health Day. So obviously lots of conversations going on about women and healthcare at the moment. So that's what we're talking about. But first of all, Hannah, what's your name and where'd you come from?
My name's Hannah and I'm from Sheffield.
And what's your favourite vegetable, Hannah?
I can only think of fruit all of a sudden.
All right. Well, there we go.
What's your favourite vegetable? What's your favourite vegetable, Rach?
Cauliflower.
Cauliflower. I think mine's broccoli. I love me some broccoli.
I was
Anytime.
Say aubergine, but that's a fruit, isn't it? I like anything phallic. Yeah.
Yes. Yeah. Well, there we go. Interesting thing that's happened to you this week, Hannah?
Fuck all, mate. Fuck all.
Oh, there we go. Right. And Rish, what's your name? Where'd you come from?
My name's Marisha, and I'm from Leicester.
Yay!
Yeah.
What's your favourite fruit, Rish?
I was getting up for vegetable. My favourite fruit is mango. Anything mango, I'm obsessed. Obsessed.
Yeah. I do like a banana though. Again, the shape.
Banana.
And I think, but I think mangoes are exceptional,
aren't they?
Rish, anything interesting happened to you this week?
No.
No, great. Well, what amazing weeks we're all having. Okay, well, and I'm
It's only Monday. Come on. I mean, it's like...
Yeah, you can go back a week, though. You know,
last week. You can't fucking remember last week.
All right, okay, fine.
I went to Big Smoke last week. That's my big fun. I know it's been a while. How exciting!
It was in the city.
It was. It was work related, but it was fairly pleasurable, to be honest, because it was about gin, and I had to go to a launch event for a famous jeweler. So how awful!
Oh wow, I'm very jealous.
Awful.
Yeah, did you get
some laid out
cocktails?
Awesome. I did get some very nice gin cocktails and some pleasant tequila cocktails as well, actually. So yeah.
I don't want to talk about tequila. I don't get hangovers, but I'm on day 2 of a hangover.
Yeah, that means you're officially old now.
I know. And that is because of a ridiculous amount of tequila.
Really?
Well, I've given alcohol up for Ramadan. I'm doing Ramadan and I have no alcohol for the next, 28 days now because I'm on day 2. So that's fun. Great.
I struggle without the booze. I do like some booze.
Yeah. Well, anyway, enough about that. So we are talking about women and health and the workplace. I have some facts and figures for you. So actually, the government, our blessed government, bless their names, did a survey actually, which published in December last year, looking at women and healthcare. And part of that survey looked at women in the workplace. So some stats from that: only 35% of women asked, and thousands of women were asked, said that they felt comfortable talking to their employer when they had a health issue. Even if it was impacting on their place of work, they didn't feel comfortable talking to their employers about it. 53%, only 53% people said that when they had spoken to their employer, the workplace was supportive and that they accommodated them and all the rest of it. And then there's loads of facts and figures. I've been reading some articles and I will put links to them in the chat in a minute. But generally about women really struggling to find appropriate healthcare, taking it out of the workplace. First of all, the workplaces aren't supporting them, but when they have needed various things, they've been really fucking hard to access, and obviously we will come on to talk about this. The impact of the pandemic has only made that worse, hasn't it? So Hannah, first of all, have you been in this position? Have you ever had to go to your employer and said that you've been suffering with something, and how was it received?
Yeah, so it wasn't even suffering. I suppose it was suffering, but when I was pregnant with Naya, I was pulled up with HR for my poor attendance. So I was having migraines which is very common in the early stages of pregnancy. And apart from migraines, like it's like the first trimester is typically fucking horrendous because you're nauseous. And not only was there, and then everything hurts.
Brain doesn't work.
Yeah, like it's not a good time. It's very difficult to work and just kind of maintain that same pace. And not only was I not supported, but I was punished for it, and pulled into HR because my attendance was low because of the migraines. So that was just one example. Another example was I had really persistent tonsillitis for a very, very long time. And when it came to having my tonsils out in my 30s, it was a difficult operation because I'd had such bad scarring, because I'd had such a lot of issues with my tonsils. And then I got a few secondary infections. I had some complications, I hemorrhaged and had to go back into hospital and stuff. So I had quite a long time off work with it. And again, different employer, I was not supported in that at all. And actually a colleague that I worked with at the time, she also was having her tonsils out, and they told her she couldn't have her tonsils out on the date that she'd been given. She had to wait until half term. But I mean, that was just an appalling employer. Like one of the PE teachers came in with a broken leg and the head wouldn't accept his sick note and told him to get back into work. Fucking broken leg.
And a PE instructor as well. It's not like you can teach that. It's not like history, is it? Just sit at the front and play some videos.
I know.
Oh
exactly.
my God, that's phenomenal. But I would not be surprised if that is not happened at some stage to a lot of people. I mean, I know when you're a teenager or in your 20s and whatever, you're working bar jobs and waitressing and stuff, they're not supportive in any way, are they? But by the time you get to, big girl workplaces, you do expect your employers to understand, particularly for things that are like a serious operation. It's not like just like you're off every Monday. You were really fucking poorly and quite obviously so.
Yeah. Or I think even like if they don't understand, but not block you having the operation, not block you either taking time off or having the operation.
Absolutely.
That's just obscene.
Yeah, because waiting lists are phenomenal, aren't they? By the time you get that slot, if you then say, no, I can't do that, you go back on the waiting list and you've got another 6 months wait or whatever, which is really detrimental. I'll come back to that point. Rish, have you ever experienced this?
Not like that. No, I'll be honest. But I think it's more a case of I just kind of, I haven't had to, quite frankly, and luckily, I haven't had any, major issues, so to speak. But I do, by default, have this kind of, and maybe it's kind of come over, quite a few years, and the attitudes that are held towards people that are off sick, or, what happens. So it's, the person that's gone off sick, they're off sick, right? But what is the talk that happens that's in the office afterwards, or around them, or because of, what's, the things that have gone on. So my experience has been more of the other side of things. And then by that, it's also a case of, well, how ill do I have to be to take time off work? And maybe I should take time off when actually, and I don't, because there's this kind of guilt, or there's this feeling that I should be doing this, that, and the other. There's a whole bunch of other stuff, to come with it as well.
That's absolutely a point, isn't it? We did do a session, I think, a while ago about presenteeism, but this is absolutely the thing, because and I was reading a really interesting article actually that was saying that most of the health outcomes for both women and men are determined not by health matters. So, for example, you go into hospital to have an operation because you've got the primary thing wrong. The healthcare sector can fix that bit. What then exacerbates or determines whether or not you're going to come out of that with a good or a bad outcome is how good is your housing, how good is your diet, have you got proper care when you get home, are you going to be hassled into going back into work, and then if you are in work, are you then able to work flexibly, take time off when you need it, have a phased return, all of those basic things. If you're just back in work after 3 days off, that is going to, the NHS could have done the best job in the world, but actually you're probably going to have a negative outcome. And
well, that's what happened to me. I went back to work too early because I felt pressured and worried. And then I got a third infection about a week after returning and had to have another 2 weeks off and another round of antibiotics. And, you know, all the trauma with that and everything. So, and I think as well, a lot of it is the how healthy you are going into it as well, not just what happens when you come out of it. So, you know, have you had access to good food and education and warm, safe housing and all that sort of stuff.
But you're right, and this is perhaps, you know, if we're thinking about this from an employer's point of view, you know, one of the things we'll come on to talk about is sort of better policies and stuff around this. You can put the best policies in place that you want, but actually it's about that attitude, isn't it? Because as you just said, Rish, if you're going back to work because you're worried, maybe you're worried that your co-workers are going to be chatting shit about you behind your back. Maybe you're just worried that your co-workers can't cope with the workload when you're not there. I mean, Hannah, you came back off maternity leave really early because you were panicking that we weren't coping without you, even though we hadn't missed you in the slightest.
You were not coping.
No, you're right. I absolutely wasn't coping. I was counting down the days till you came back. But you know, there's all of those sorts of pressures. It's not necessarily just a sort of HR thing, is it? It can be a cultural thing as to whether or not you feel able to take that time off, and that's really tricky.
Yeah, sorry to interrupt, but from my perspective, it's definitely a culture thing. And actually, you know, like thinking back on it, I'm terrible for recognizing things when it happens. To be honest, it's more like afterwards, and you kind of think about it and think, "What the fuck was I doing?" Right? You know. So like, I went out on the one occasion I had to go to the dentist, and it should have been, you know, a straightforward appointment, an hour. But actually, I had to have some work done whilst I was there, and you know, the feedback I got was, because I'd taken, you know, a morning as opposed to an hour. Where's Marisha? What's she doing? Like literally that was it. And it's like, hang on a minute, like I'm there all day, every day, you know, on hand when anyone, you know, and actually it was a contributing factor to me going off and working for myself. You know, because of that attitude. Like it's just bullshit, right? But sorry, go on.
Well, no, I was just going to say that when somebody's got something obvious, an obvious thing, so they've got an appointment, they've got a medical thing that they're going to, it's kind of that's one thing to deal with. What makes that even harder, or this situation even harder, is when somebody's got a mental health issue, or maybe they're just at the start of feeling anxiety or depression or whatever. Because when you're in that headspace, your natural inclination is to start worrying that you are a burden on everybody else, and that people, you know, so you get in that kind of paranoia. So, I mean, people are just not going to take time off, or they're not going to seek the help that they need. And this is what one of the reports was saying, that actually, if we don't create those nurturing spaces where people feel able to raise issues in the first place, they won't seek help, so that by the time that they do seek help, it's 10 times worse than it otherwise would have been had they just sought help at the beginning. So we're having all of these, you know, we look as a society, we look to the NHS, don't we? We're like, I am ill, you fix me, and then we'll go back to work and everything's better. And actually it's the domino effect on all of these other cultural factors is miles bigger than we recognize.
And that's a good point about preventative measures, about employers allowing people to take preventative measures. So one place that I did work at that was really good, this was a good thing. They gave you a certain number of instances of illness. So it didn't matter if you were off for a day or a week and a half. Like you had instances of illness, and that was to encourage you to actually rest and get properly better. Because and the same like with the dentist, Rish, like if you go in, like if you went to the dentist more regularly, your teeth wouldn't be in a shit state that they are. But like but no, so you know, if you allow your employees to go and have maintenance on themselves, on their, you know, go to the opticians, go to counselling, go and do exercise, go and have your teeth, you know, go to the dentist. If you allow time off for that, then there's far less likely that they're going to need longer time off because they've got musculoskeletal issues, or they've like got galloping depression, or their teeth are dropping out their head. So, you know, I think healthcare, like always, everyone always says prevention is better than cure. You know, allow your employees to look after their health and encourage them to look after their health, so that it doesn't get to the point where they're in dire straits.
Do you know what that comes from as well? I'll just have to kind of put in there, because it's, I know we primarily talk about you know, women's health, but there is also it's that kind of, hopefully it's moving out now, where there's this kind of attitude of they're lucky they've got a job. or and therefore being taking time off for that maintenance, for example, is a luxury, because that's kind of how some people seem to think about it, and hopefully that's changing now.
I think that's a class issue. So I think that's a classist issue. So if bankers and kind of professionals, like the white collar, traditionally, if they take time off for the dentist, it's fine because they're valuable. But if a supermarket worker or someone picking vegetables takes time off, fucking hell, they're lucky that they've got a job. They should be working harder. I think that's
that goes so far. That comes into everything, doesn't it? Like even working time directives. Factory workers still can work sort of 8, 9, 10-hour days quite legally with some loopholes, whereas city bankers, they start at 10 and they finish at 3 and they have 2 hours off for lunch, and we've always allowed that to happen. I do well, you just said, Reece, that hopefully things are getting better, and I do want to just throw in the pandemic, because I do think certainly things were getting better, and we are naturally moving towards a much healthier workplace culture generally. But do we think that the pandemic has negatively impacted this? Obviously, we know the pandemic has had a massive impact on wait times, and people are not going for routine things like the smears and the mammograms because the pandemic's had an impact on that. But has the pandemic had an impact in the workplace as well, in that some employers are thinking, right, you've just had 3 months off on furlough, and you can't have any more bloody time off? And do we think there might be a little bit of that attitude on there from employers towards their employees?
I've heard kind of friends in my network and stuff talk about people, well, you never know if they're faking it, do you? Like, they say that they've got COVID, but I don't know if they're faking it. And I know people whose employers have said to them, if you've got COVID, you get your ass in, whether you've got it or not, because there's nothing stopping us now. So, I mean, for me, as an employer, I feel better that people are taking time off when they're ill. Like, I always want people to take time off when they're ill, firstly, because it stops them infecting every other bugger. Also, they need it. They're ill for less time. But I think there is now a thing where it's even more okay to come in when you're ill, because how ill are you really if you've got COVID and get yourself in? So I was hopeful that there would be a shift towards, if you're ill, stay at home under the duvet. But I don't think there is. I think people.
Well, my friend Karen, she's just had a third bout of COVID since the pandemic began, and she works in a school, and obviously this week is the start of half term. She tested positive on Monday last week, so she was essentially she was going to have to miss an entire last week of the term, and her employer was like, well, you can't, it's the last week of term, it's the busiest, just be ill now and come in. And Karen was like, no, I've got a positive COVID test. Until I'm testing negative, I'm not coming into work. And she got shit off her manager for that. Now, fortunately, the company above that backed up what Karen was saying. But this, I think, again, this is rife, isn't it? And now that whereas it was 14 days, then it was 10 days, now it's 7 days. Now you've got to pay for a test, so people are not even going to be buying the tests, are they? So, I mean, I think we are definitely, employers seem to me, I've heard a lot more stories lately, I think, of employers saying, I don't care if you're poorly or you're negative or you're positive, if you're not dying, you're coming into work.
I think there's
Sorry, go on.
I was going to raise long COVID being an issue as well. Like, we don't understand that yet, and I think there will be a backlash against people with long COVID missing work.
Yeah, well, and I think that's really serious. Actually, we need to factor in things like that. Go on, Risha.
Definitely. I mean, well, my experience of it currently is what COVID? It's like, it's done. What do you mean? That's over now. Exactly. We're finished.
So 2020,
isn't it? We're finished with that.
We've got the second highest rates at the moment that we've had since the start of the pandemic. It was we were only slightly higher in the Omicron wave. Now, admittedly, hospital rates are still low because a lot of people are vaccinated, but there's more COVID around now than there was. There's 3 times as much COVID around now than there was when we were doing lockdowns. And yet everybody is in this mindset of, we're done. That was it. Remember when we had COVID last year? It's gone now.
No, I know, it's mad, isn't it? And I think because of that, I mean, when COVID first hit, everyone was saying, "Oh, HR policies, HR law, that will catch up," and I don't think it ever will. I just think it'll be treated now like the common cold, and even though it's not, it's not that yet, and it could mutate into something more vicious. I think that's kind of how it will be treated legally.
But I definitely think when the government said, beginning of March 2022, that, they lifted all restrictions, I absolutely think that gave employers carte blanche to back to normal, get everybody back in. I mean, it was the CEO of somebody, wasn't it? I was talking about this on another podcast the other day, but I can't remember which company it was, but they were saying, they want it from Monday morning. We want everybody back in the office 9 to 5. COVID is done. That's it. And only a third of the workforce actually did it. And now they're like, do we sack 2/3 of our workforce, or do we let people work from home? So I think there's people power there, isn't there? Now then, I want us to move on, please, to what the recommendations were. So off the back of this government report that they were doing, they gave some recommendations about what workplaces should do to help women. First one was flexible working. So, I mean, we've said this with Grow Traffic. This is why we work in the way we do, because we said at the beginning, we want a workplace that works for women, because if it works for women, it'll work for men. And so we've always had flexible working. But that thing of, women being able to care for somebody or be off because they're poorly or go and get their child, whatever, that leads to a better quality of life. If you've got a better quality of life and you're less stressed, you're less likely to become poorly. Again, we're back to prevention, aren't we? Do we think it's feasible that employers will move towards flexible working? Can most people do it, accommodate it? What do we think?
I think it depends on the sector. So I think, kind of service industries, some might struggle, especially hospitality and kind of customer facing service industries, retail and stuff.
And we have to think about that, don't we? Because they are on their arse at the moment, the hospitality sector in particular. So, how are they expected to recover from the pandemic and do all of these things to make sure their staff are well? If you were an employer in a hotel or whatever, I would imagine this is a real stress to look at it from the other side.
Yeah, so I think there's a lot of pressure on employers at the moment to increase wages and pay more and stuff, and that's fine. I do understand that, but I think if you're doing that, then you can't have an abundance of staff to cover as well.
Yeah.
It's very difficult, isn't it? Because it's very it's hard, I think, for us to be able to kind of see that, because I work with a lot of service-based businesses that it's just not feasible for them to kind of adopt those types of kind of working practices. So I think that for me, in the most idyllic way of putting things, I think it comes a little bit from what happens when you're onboarded into that company in the very first instance, and what the perception is of illness, and for how things should be treated, and women's issues as well. So by that point, I've read things on, and we actually had a lady on one of these calls that was talking about coaching for menopause in businesses and things like that. And if that actually forms part of the conversation straight away, that it's you talk about it openly, because on one side there's that, but I also think it's kind of dangerous then to say women do this, men do this sometimes as well. There's that separation, even though there clearly are differences, right? But I do think there needs to be some kind of just acknowledgement of this is the way that we act. This is what happens. Yes, we've got sanitary wear in the toilets. Get used to it. That kind of stuff.
I think, you've covered point 2 actually there, Rish, which is better. It's all right, quite all right. This is what we like you to do. But that's better provision for workers, and what they mean by that is not just providing sanitary towels, providing spaces and opportunities for people to have conversations, providing OcuHealth, but it's actually widening out the parameters of that conversation. So you don't just get time off when you've had a baby. You get time off if you've had a miscarriage, or you get time off if you've adopted, or
having fertility treatment.
Having fertility treatment, exactly. It's about widening the scope and saying, okay, at the moment we have a very definite narrow definition within the workplace of what illness is, and it's essentially you've got a temperature of 52 and you're dying, and that's it. And actually, no, it's this wider thing of prevention before we get to that point. Because actually, if you give somebody, I don't know, a week off when they're perhaps a little bit poorly, you're not then going to have to give them 2 years off a little bit further down the line when they're very poorly. So it's preventative for the workplace as much as it is for the healthcare sector. So I think
as well, there's not quite so drastic things that you can do in a workplace. So loads of studies show that having time away from your desk for your lunch is really important. So if you've got the space we've got the space, then create an environment where people are able to go and eat their lunch somewhere else, and make it, perfectly acceptable for people to leave the office on their lunch and go and, drive to somewhere and get some lunch. Give a long enough lunch break that people actually get some downtime, because there's so much temptation just to work through your lunch or sit at your desk and eat your sandwich, and actually that's not restorative.
Do you know what? One thing we did as well, and I remember this when I was working at the NHS, because everybody had a printer on their desk. And what the NHS Trust said was, we're getting rid of desktop printers. We're going to have 3 printers in the building. And everyone was like, oh my God, I'm going to have to walk miles to the printer. But that was the point. They made it so that you had to get up. They scrapped a lot of the stationery cupboards and consolidated it into one. And the theory was, you need to get up from your desk and move around. Like, we're not just going to create a working environment where everything you need is right in front of you. We're actually going to have to make you get up and go to the kitchen, or get up and go to the store cupboard and get up and go to the printer. And I think, again, that's just little small things, changes that businesses can make, which actually a money saving, as well as
a fucking printer per desk. Bloody hell! Yeah, no wonder the NHS is on its knees if it's buying everyone a printer for the desk.
Yeah, no, it's disgraceful, isn't it? It's like prisoners having TV. It's the world gone mad. Political correctness gone mad. Anyway, so that's point number 2. Point number 3 is better policies. So you touched on this, Reece, didn't you? It's about having those conversations when people come into the workplace and saying, this is what our culture is. You are allowed to be ill. You are allowed to talk about us. And I do just want to say as well, when we're talking about women in health in the workplace, men and health in the workplace is actually much worse, because patriarchy, men don't talk about particularly when it comes to mental health issues, men just don't talk about it. So this works for both genders. But having that conversation at the beginning, being open, saying this is the type of workplace where you are allowed to be ill and you're allowed to talk about things, and if you've got a problem, come to us. But actually enshrining that into your policies and your workplace handbook, your employer handbooks, and making sure it's explicit, because otherwise it's only as good as the manager you've got in place at the time, isn't it?
I mean, the thing is, you could pay for your bloody walls in policies, but they don't mean shit if you're not actually embedding them.
Yeah, I agree.
And yes, you can tell them this when they arrive, but it comes from the top. You actually have to demonstrate, practice what you preach. So if you're a business owner, don't come in when you're ill, and say to, if you're having a shit day, say to your staff, I'm fucking miserable today, I'm having a duvet day. Practice what you preach, and make it an environment where people can come and say, I need some time off, or I'm going through the menopause and I'm fucking knackered, or whatever. Like,
get me a fan. I'm sweating my tits off. Come on.
Yeah.
It's true. It is true.
That's so true. Yeah. Like, I think just as a business owner, as a manager, model the behavior that you want in your employees, and don't make it like hierarchical. Don't kind of do one rule for one and one rule for another, because this company, this team are customer facing, and this team is finance team, so if they're off for a couple of days, it doesn't matter. But it does matter if they're have it so it's equal across your company, that the same applies to everyone.
Yeah, and open. I mean, we've said before, haven't we, about creating spaces for those conversations, whether that be physically or just sort of mentally, but saying to people, and you need to say it repeatedly, if you have got a problem, you can talk about it here, or you can email me here if you don't want to talk about it, if you don't know how to voice those things, and just making it really obvious. But you have to keep saying that to people, because otherwise they won't, will they? They won't. And then point...
I can't remember. It's gone.
It's gone.
So out there. It's very, very strong coffee.
Fair enough. And yeah, point number 4 then. So for better support for women coming back into the workplace. So whether they've been off for 10 years because they've been having kids, or they've been off for a year because they've had stress, or they're changing careers because they couldn't do the job they were previously doing, so now they're having to do a desk-based job, for example. At the moment, there's not a lot of provision for those women, and it's the same for anybody really. We tend to throw people in at the deep end, don't we? But I think it's about encouraging employers to say, actually, you know, a woman who's been off for a significant period of time is probably going to need a lot more support. They're probably going to need a phased return. They're probably going to need retraining on how to do things. They're probably going to need flexible working for, you know, 6 months, or a little bit of additional support, maybe having somebody there to support their role. So, you know, I think we have to think about, women have different phases to their lives, as does anybody. But how do we support women through all of those phases, and not just create policies that are aimed at 20-year-old women that don't have any kind of dependence or anything?
I think so where I used to work as well, the bad place, as we'll call it.
The bad place.
There was a woman there whose childcare suddenly changed. So I think like the nursery put their fees up and she couldn't afford to get a child in as often or something. So she needed later start times and earlier finishing times, and they wouldn't give it her. So she just started like calling in sick on those days, and her engagement went through the toilet, and she was pissing off everyone around her, and in the end she left, you know, as you would do, while she found another job that could accommodate her. And one of the reasons was, well, you know, we'll set a precedent. But so what? So what?
Yeah, we'll set a precedent that we are nice employers, and we cannot have word getting out about that.
I know, exactly. Like if you set a precedent that you listen to people's concerns, you respond on an individual basis, and you are flexible with people, I don't think that's a bad thing. You're not necessarily saying, okay, everybody's going to now start at 10 and finish at 3. Like, it's not that. I think you need to be able to demonstrate that you work on a case-by-case basis, and you act with humility. Is that what I mean? Humanity.
Yeah.
Humility.
Yeah, and compassion. Yeah, both.
Empathy. All of the words.
All of these words.
All of her words.
Excellent words. It's true, and I think that's really important as well. You know, back to being open and honest with people, of saying, you know, again, people's needs change at different times. So it's all right to say to somebody, you know, I'm not sure you need that provision at this time. We're giving it to this member of staff because that's what they need right now. When this problem or issue or phase of their life is over, they will go back to working this way. When you need something, we will respond in the same way. And actually, you know, we were talking about this on Friday's session, Hannah, weren't we? About your employees are not children. You don't need to treat them like children. They're grown-ups. They're intelligent people most of the time. So, you know, yeah. Some of them
been an employee, let's just remember.
Yeah. You know, so you can, they're not, just because you allow somebody to have perhaps later start days, everybody else isn't going to go, right, well, I want that now, blah, blah, blah.
I think that's the thing. I think there's a fear in business owners that your employees are trying to screw you at every stage. Like you give them an inch and they're going to take a mile, and the work shy bastards and stuff. And if that's your opinion, then you shouldn't have employees.
Or get some better. You've got the wrong employees. Yeah.
Or your company culture is toxic, because you should, like, it's, I mean, and I don't want to come across as preachy, but it's not rocket science to build a company that has a culture that supports your employees. And speaking from experience, you get way more from them because they're loyal, and because they like, you know, they don't dread it on Mondays, and they don't throw sickies and stuff, because they're treated like adults. They're given progression, they're given respect and responsibility, and they respond well to that as ambitious humans, you know. So
yes, as we would,
yeah, like
everybody does.
Yeah, like, you know, everybody has something that motivates them, and your job as an employer is to find what that is and motivate your team, not with a stick but with the carrot.
Absolutely. And so if you're, to bring it back round to the beginning, if your employees are, suffering, and I think as well, look out for the signs. They're quite obvious. If somebody is suddenly, starting to struggle with their workload, or they're not as engaged, or we notice it sometimes if a member of staff isn't active in the WhatsApp group for a while, and then we'll just go and check in on them and say, are you okay? We've noticed you've not been as chatty perhaps. So there are ways you can tell and be proactive about it, because as we said before, it's better that they have a week off now than a year off further down the line because their health has suffered. Rish, final point. Wow us with your wonderful insight.
I don't have any wonderful insight today. I think
you say that every week and then you shock us.
I know. Well, it's not really insight, but listening to this, because I most of it, I think, comes from that kind of toxic environment and, just horrible workplace, policies, activities, etc. And I think what would be, really interesting, and I guess, would be quite brave on maybe some employees' parts, is to actually ask the team and ask the questions. Because what I think happens a lot of times is that you might start off with all good intentions, right? But actually you're so ingrained in your own business in the day to day, actually it's got shit and you don't realize that because you're in it and you're doing it. But actually the outside perception is very different. You've got high turnover, for example. It might be that, high staff turnover, you might think, yeah, but they're all shit at their jobs. But externally, people are thinking, well, why is everybody leaving there? There must be something wrong, right? So I think there's a lot to be done from an employer side of things, and you have to be kind of brave, I guess, really, to ask those questions of yourself, your business, your company culture, to actually make change. And because a lot of it also comes from familiarity, I think, and that whole we're a family kind of style of working, which is not always ideal.
No, and you know what? I don't want to grow traffic up as some sort of pinnacle, because I'm fully aware that we've got many flaws that we're working on. But we just have a fortnightly meeting that is a team meeting where we just ask everybody, are you okay? Is there anything massively going on that we need to know about? Are you worried? And if you don't want to tell me in this meeting with everybody, we have it as like a safe space. You can bring whatever. But if you don't want to tell me here, please come and tell me afterwards. And I just think so many places of work don't do that. They just never say to them, are you okay? What's going on? How do you feel? Is there anything we're getting wrong? And it's really important just to have that conversation. Correct. Well done. Top marks, 10 out of 10. Clever girl. Hannah, final thought.
Yeah. I think just, don't rely on your policies. Practice what you preach.
Yes, absolutely. Very important. And I think that, let's believe women. We've got enough bloody problems with the health sector and doctors, male doctors and things not believing what we say. So as employers and in the workplace generally, please, if somebody's struggling, just believe them and have a conversation and see how you can help, because you will get more out of your staff doing it that way. There we go. That's it. All done. We'll be back in 2 weeks' time. No idea, as ever, what on earth we're talking about, but it will no doubt be awesome. If you've watched this live, thank you very much. If you're watching it back, you can still leave us a comment and we will see it. And I will put some links to the articles I mentioned in the comments. If you are listening on podcast, please like and subscribe and rate and whatever. And if you're watching us on YouTube, subscribe below, guys. Subscribe below. That's it. Thank you very much. We'll be back in 2 weeks. Wave, girls.
Bye.
Bye.